Hello, this is my sports webinar assignment for exercise science, and the injury that I chose for this topic was inversion ankle sprain. Now, as you can see from this slide, these are some x-rays of what an ankle that is in a good condition will look like. Now, as you can see, there are no sorts of separations in the ligaments or fractures on the bone. On the other hand, in this slide, these three pictures shows a perfect example of what an inversion ankle sprain would look like. Compared to the x-rays of the ankles from the slide before, these pictures shows the separations of ligaments that causes the injuries that is so-called inversion ankle sprain. I will explain further what some of the labeling is in these pictures are in the next few slides. Now I will be talking about the ligaments in the ankle. Firstly, ligaments are fibrous connective tissues that connects two bones. As you can see from the picture, it shows a lateral view of the ankle. In the ankle, there are three types of ligaments: anterior talofibular, calcaneofibular, and the posterior talofibular. The anterior talofibular connects the talus to the fibula on the outside of the ankle. The calcaneofibular connects the fibula to the calcaneus. Finally, the posterior talofibular runs at the back of the ankle and located higher up the leg. Next is the bones that get affected when an inversion ankle sprain happens. The three main bones would be the tibia, fibula, and fractures on the fifth metatarsals, or pinky toe. X-rays are to make sure that ligaments is torn, but in severe cases, MRI is used to see if there is any damage in the cartilage. There are three levels of severity, in this case, grades of ankle sprain. Grade 1 is a slight tearing of the ligament with mild swelling. The ankle still feels stable to the point it being possible to walk. Grade 2 is a larger but incomplete tear with moderate pain and swelling. Damaged areas are sensitive to touch and walking is painful. Lastly, grade 3 is a complete tear of a ligament with severe swelling and bruising. Walking would be too difficult to do as it causes intense pain. The four main symptoms for you to tell whether you have an ankle sprain are obviously the feeling of pain, your ankle and surrounding areas start to swell, you get paresthesia, and having muscle spasms. Inversion ankle sprain happens a lot in sports, mainly the sports that involve a lot of jumping or running, such as basketball or football. It could happen either from landing wrongly or doing quick sharp turns when running, or it could just happen from out of nowhere. When it comes to treating ankle sprains, the typical treatment that everyone should know how to use is the RICE treatment. Each letter is a different step. R would be to simply rest, I would be to ice a specific injured area, C stands for compressing in order to help reduce the swelling. E would be elevating the ankle above the heart to also reduce the swelling. The estimate recovery time depends on the severity of the ankle sprain. Minor injuries could only take several days, and that person can go back to doing activities. Major sprains, on the other hand, could take weeks or even months. A grade 3 is a good example of a major sprain. Recommended physiotherapy exercises in order to help speed up the recovery are one-legged stand and the wobble board training. It is recommended to start with one-legged stand where you would do a single leg squats. Wobble board is for balancing exercises. Patients would start with two-leg balance exercises. As the ankle starts to get better, they would then move on to one-leg balance exercises. Most of these exercises are used to help strengthen the ligaments in the ankle.